So I wanted to give you guys the option to do the glutes from the sideline and also the QL from the sideline. There's a lot of stuff we can get done from the sideline, and this is another thing that not a lot of massage therapists do is sideline work, but it makes this lateral edge of the body just so much more accessible to us. So let's start with the glutes. We have the iliac crest, we can find the as is, and then the bump on the backside is the posterior superior iliac spine. And in between the posterior superior iliac spine and the anterior superior iliac spine, that's the iliac crest, the beginning and the end. So we have the iliac crest going both to the posterior and anterior iliac spine. And then the greater trochanter is, where is this greater trochanter? Right here, popping out nice and big. So when we were doing our glutes earlier, I can only go so lateral without having to kind of tweak my body. But bringing them sideline, this lateral side of the glutes are very accessible to me. And now it also opens up is just posterior to the as is the tensor fascia lata. So I have tensor fascia lata here, gluteus medius big here, and gluteus minimus underneath that. So I can do all of my compressions all around, starting at the posterior to the as posterior as comfortable for me to get, with my vector going towards that greater trochanter. So here's his iliac crest. I'm going to roll over to be inferior to the iliac crest. And I'm also posterior to the as is, so I'm specifically here, I'm on the TFL, the tensor fascia lata, which turns into the iliotibial tract. So both the gluteus maximus and the tensor fascia lata become the iliotibial tract. So those are two muscles to work on when people have a tight IT band. IT bands can be very, very sensitive and hard to work on directly. By working the gluteus maximus and the TFL, we can individually, is that a word? We can work the iliotibial tract through those two muscles. So pressure straight down, vector towards that greater trochanter. If you notice, when I'm working on sideline, I try to get somebody to scoot back onto the table. I'm going to come out of that compression as I speak. To scoot back onto the table as far as comfortable to them, so I don't have to reach across the table to work on them. So I'll put my hand here and have them scoot back. And I like the bottom leg to be straight and the top leg to be bent. And I'm trying to stack, I try to stack their joints. So I try to stack their hips on top. Sometimes they'll find that they start to fall forward and I'll just kind of pull them back. And I try to get their shoulders to be stacked, which is as comfortable for them. And I usually give the pillow so they have support on the neck as well. I want them to be comfortable. People who have shoulder issues can only be here for so long. So there's my first compression. I'm just going to work myself down in a straight line until I hit the iliotibial tract. Until I hit the greater trochanter. But the tensor fascia lata turns into the iliotibial tract. So first my pressure, then my vector. And I think there's a hip point here. If I couldn't tell you the name of it, but if I go back to my Eastern modalities, I think there's a spot here that's important. And then I'm getting close to the greater trochanter, so I'll probably be able to do one more compression before I hit the greater trochanter. And usually as we get closer to the insertions of muscles or any bony landmarks, it gets a little more tight and a little bit more sensitive. How's our number?
About a 5.
About a 5. So let's practice our not using much energy, but maybe adding more pressure by just moving my arm and see if we change his pressure. Let me get a little bit more specific. Are we still at a 5?
We're at a 7.
We're at a 7. So you saw all I had to do was get more specific by bringing my arm out, getting a more point on my elbow, and it brought up the pressure. So here's his greater trochanter. So now I'm just going to do another line, and I started just posterior to the as is, so I'm going to come back, and now I'm getting a little bit more into gluteus medius, which deep to that is gluteus minimus. So again, sinking down for pressure. And I'm just continuing the same pressure and vector. Straight down to the body for pressure, vectoring towards that greater trochanter. holding it until I feel a sense of a release. It kind of creates a little pocket around my elbow, and sometimes that pocket just becomes a deeper of a pocket, and that's how I know I'm making a difference in that fascia. Sometimes it just startly kind of melts like butter. And I'm just moving myself down with another compression. How's this number?
About a 6.
Okay. He's at a 6, and I can be here all day. It's not difficult. A lot of places like to charge more to get deep tissue massage because they say that the therapists have to work much harder. We don't have to work harder. We have to just work smarter. But if they're going to pay us more money, we'll just say thank you, and we will take it. But it shouldn't be any more difficult than any other modality that you do. And this will probably be my last compression before I hit that greater trochanter. Straight down, and then vector. Oh yes, I'm supposed to smile. Pressure?
6.
6. Nice and relaxed. Everything's relaxed. So as we slowly come out of there, I'll just do another series of compressions coming back up. So we just did 1, 2, and I can probably do another set here. So I have to scoot back a little bit. This is a lot of times where the leg starts to come forward, so sometimes I'll just kind of hook my hand in near their as is to hold them back, and I can also kind of pull them into my elbow, my forearm. And gluteus medius, one of its jobs is to hold the femur into the socket of the hip for the hip joint. So when we take a step, it has to hold the entire weight of the body so the other leg can lift. So if you have extra weight on you, this muscle can get very, very tight. And that's what brings the waddle on some people, like sometimes you know the pregnancy waddle. It's because this is a little muscle that has to work really hard holding the whole entire weight of the body just to take a step. And if one side's in trouble, you're gonna hop off of that muscle really quick because it's already taxed. So if you notice, if you see somebody with a slight little waddle as they walk into your room for a massage, that can just be a sign of where you should probably start working. This gluteus medius muscle is a very passive aggressive muscle. It works really, really hard, but it usually doesn't hurt in this area. It hurts, it can go up into the lower back. Lower back issues can be caused by this gluteus medius, hamstrings. And I'm just slowly working down again towards that greater trochanter. And just like before, I also like to work around the greater trochanter. And now that the greater trochanter is more accessible to me, it allows me to get more specific. So there's my last compression on the medius. So here's the greater trochanter, and all I have to do is be on it and then just roll off and then pull the muscle away from the bone. Roll off, pull the muscle away from the bone. So this allows me to kind of get into all of those insertions. As I'm up towards the top, it's going to be medius and minimus. And if I work myself down towards the bottom, it's going to also be piriformis. That all grab onto that greater trochanter. And again, I think this is just feels like really specific work. And not a lot of people get this kind of work done. So when you get this specific in your work, it really makes you stand out, I think, from other massage therapists, because this is a spot on the body that needs attention, that doesn't get it, because it's hard to access if you're laying in the supine or the prone position. And you can move your way down, or you can switch elbows, whichever feels better for you. So now his greater trochanter is right about there. So I'm probably maybe at like 4 or 5 o'clock. And every compression I do is going to be slow, and I'm going to be invited into the tissue. It's going to slowly melt, allowing me to go deeper and deeper. And then I'm going to come here and do my last compression around that greater trochanter. So again, this is just another way to access that lateral side of the body that's hard to get to when we are in a prone or a supine position. What also opens up for me in this position is the QL. So remember that small space that we had with the QL when we found the 12th rib and the iliac crest. So we're going to find those same bony landmarks, iliac crest, 12th rib, a small little space, but now the erector spinae is out of the way, so I just have to go straight in. So if I do this bulk here, this is all the erector spinae, and if I go straight in this way, then I'm going to get into my QL. So now this QL is much more exposed, it's much more vulnerable. It doesn't like a lot of attention because it's a hidden muscle in the body. It's one of these core muscles. So we really have to take our time to go in slow here, because if we go in hard and fast, we can really, really hurt somebody. So please be careful when you're working on this. So find your erector spinae, the lateral side of that iliocostalis. Find the iliac crest, find that 12th rib. And we're just gonna go straight down. I like to use supported thumbs just to go straight down. This probably will not take much effort on my part at all to get pressure because the muscle is so exposed. Remember, this muscle does elevation of the hip as well as lateral flexion of the spine. So I can ask for either of those movements to help me know if I'm on the muscle, if I'm in the right spot. So can you lift your hip up for me and try to smash my thumbs? Thank you. So actually I need to go a little bit more lateral. Or can you do a little side sit up for me? Okay, thank you. So whichever one works better. He didn't lift himself all the way up, but I felt that muscle. Maybe you can see it contract. Can you do a little side sit up for me? You can see it lift my thumb up. I know I'm on the muscle. So now that I'm on the muscle, I'm just gonna relax and I'm just gonna slowly, I'm in a horse stance, I'm just gonna bend down and add a little bit more pressure as he exhales. When they exhale, they're letting out carbon dioxide, and they're making space for me. So they're making little pockets as they exhale. So the deeper they exhale, the longer I can go down with my pressure. If their exhale becomes a little bit shorter, a little instead of a, that's their way of telling me that that pressure is good enough. You know, I can really start to tell when I keep a rhythm how deep I can go depending on their exhale. How's that pressure? So just like in our demo earlier when we were laying in the prone position, right now I'm going straight into the belly of the muscle, but I also want to vector towards the ilium, and I also want to vector up towards that corner of the 12th rib and that lumbar vertebrae, kind of near L1 and T12. But now I'm going to go this way. So I'm going to go straight down, and I'm going to vector towards the origin of the Quadratus Lumborum, the iliac, which is the iliac crest. So he's taking a breath in. Can you do a little side sit up for me? Okay, thank you. Another thing too, if you ask them to do a little side sit up when you're in there and they barely want to move, that's another way, another indication to tell you that you're right on the muscle, because sometimes it's already a lot of pressure and they know if they move it's going to kind of feel jabby, so they just are kind of hesitant to move. So that's another indication for me that I'm on the muscle, and then I can feel it move underneath my thumbs again. And he's giving me little releases. I can feel, they feel like a little bit of a, it's not so much as a spasm, it's just like a little broop, broop. And then I'm going to do the same thing with my vector towards the vertebrae, but at a kind of a diagonal to get in the corner between where the ribs meet the vertebrae. Sometimes people are really tall, torso-wise. There has been times when I make space for my knees. Could you scoot in just a little bit for me? There is times that I have made space for my knees and I still get close to them and I support them up against me, and then I can just come down the same way I just did, but it gives me a little bit more leverage. So that is also an option. So 1, 2, 3 vectors, finding those bony landmarks. If I wanted to undrape, I could undrape. If it's a female, I usually ask them to hold the sheet, and I'll just pretend Elijah, we want to not undrape his chest. And then I make sure that they're tucked down below, and you can see where it's red where we've been working. And then that exposes the area, but any compression I can do directly over the sheet. So depending on their comfort with me, I can do work either way. But just for demo's purposes, here's his 12th rib, here's his iliac crest, here's his erector spinae. So I need to be working in this area here. And I'm trying to, now the erector spinae is out of the way so I can go straight into the muscle. And can you do a little side sit up for me? You can see that muscle, thank you. You can see how that muscle contracted and pulled me out. So that is that work, and just like we did earlier, our intention here is to move the ilium away from the lumbar vertebrae to open somebody up this direction. So I like to give them a little stretch after the work is done, and I will take that top leg and I will straighten out that leg so it's nice and even. And working with their breath, I like to give them a nice little traction and give them a nice little stretch. And I'm hanging on pretty good to his ankle. And I let him hold it for a full breath. It's not a jab, it's just a slow pull back. And then on his exhale, I'll slowly let him go. And it wouldn't surprise me to hear that a client tells you that they feel taller and longer. So, another option for some sideline work. There's many more muscles we can work on here, but this is a good place to start.